Hello, everybody, and good evening. Thank you for joining us this Tuesday night. I just have to think about what day of the week it is. I've got some great topic to discuss with you this evening. So hoping you're going to stay with us for the hour, and obviously hoping more people come along and join us. We're going to be talking about menopause tonight. This is our monthly space where we come together to talk about all topics that we think are worth talking about, that are interesting, that are going to be beneficial to our audience. And this month, I'm joined by Sarah Lyon, who is coming to us from Newson Clinic, and she's going to introduce herself in a little bit, and also from by Jules Knight, who some of you may know from a Twitter space before. Jules is our young onset specialist nurse at Dementia UK, and hopefully joined by a lady called Maeve, who we're really excited about because Maeve is joining us as somebody who is living with young onset dementia and also has experienced menopause. So I know that Jules is working hard behind the scenes to help Maeve, Maeve get into the space and get everything working this evening. So just before I invite my guests up, I'm just going to tell you quickly how spaces work because this might be new to you. It might be something you've not been involved in before. You'll see on your screen, if you've joined on the phone, you'll be able to see some icons down at the bottom. This is probably the most important thing that I want you to know about today. So you've got a little icon at the bottom of your, if you say this only is if you're on a mobile phone. If you're listening via your laptop, you don't have this feature. And obviously, if you're listening to the recording after the space is live, you won't be able to do this either. But if you're listening now and you can see the little heart, which is down at the bottom of your screen, it's a heart with a plus sign. If you click on that and just any symbols that are there, you will see different symbols that you can use to just let us know that you're there and you're listening. And if you've got those, it's just really good to use them so we know who can interact and so if you're listening in the space now and you can see that little heart with the plus sign at the bottom, just give us a wave and we know that you're able to join in that way. If you can see that, that would be really good. Thank you, Naz. I can see. Thank you. Excellent. I can see lots of icons popping in there. Fantastic. So that's just a really good feature because it lets us, the speakers, know that you're there, that you're listening, that you agree with something we're saying, or just that level of interaction is really useful. The other feature that I want to draw your attention to is the mic. You'll see that at the bottom left-hand side of your screen, the little mic button. We want this to be an interactive space. Really happy for people to join us. Obviously, if you're listening to this live, to join us and ask questions, get involved that way. So do feel free to stick your hand up at any point and ask to come up and join us as a speaker, and whether it's to ask a question or to just share a story or an opinion or whatever it is that you need to do, please feel free to join us that way at any point during the evening. We would love to hear from you. So that's as much as I think I'm going to tell you. The other feature, actually one more feature really quickly, because I know this is useful for some people, is the caption feature. So where you see the three little dots at the top, you've got a share icon, which allows you to share that you're in the space, but next to it, you've got three little dots. And if you press those dots, it will bring you up an option to turn captions on. And some people I know find that really helpful because it means that they can read what's actually being said as well as listening. And for some people that helps them to engage with the space. So just wanted to draw your attention to that. That's enough of a kind of how to use spaces. I will probably do a quick refresh halfway through, just so as many as people as possible know how to use it. I know that Jules has left temporarily. I'm hoping she's going to come back. But Sarah, can I bring you up to unmute and say hi to everybody and just tell people who you are, please?
Hi, Vic. Yes, thanks for introducing me. My name is Sarah. I'm an advanced nurse practitioner and I work in general practice. So I do half of my week working in urgent care. So I see all the same day consultations in general practice, but also increasingly I'm seeing more menopause patients in that role. And I also spend half of my week working for the Newson Health Clinic, although I do video calls. So I'm based from home, although a couple of times a year I go up to Stratford where the clinic is based, and manage lots of menopause ladies, all ages and lots of different backgrounds. So that keeps me busy. I'm in my 50s myself and I'm on HRT, so I understand some of the sort of menopause journey, although all of our journeys are very different. So there is no one size fits all approach. I've got 4 grown up children as well. So I'm one of those mad women with lots of children, although they have all left home now. So I've got a couple of little granddaughters as well. So that's me.
Thank you, Sarah. Can I ask you, just for anybody listening, could you tell us what the Newson Health Clinic is, what you do there?
Ah, yes, sorry, I probably didn't make that very clear. Yes, so it's a menopause, it's a private menopause clinic. It was set up by a group of GPs, but one of them is Dr. Louise Newson. Some of you may have heard about her. She has been working with the media, so she's been on Good Morning. In fact, I think she was on Good Morning Britain today. She's worked with Davina McCall, and she's a GP by background, and she started the clinic because she went into menopause in her early mid 40s. And ironically, you think as healthcare professionals we all understand menopause, but actually we don't. It's not something that is particularly taught in medical school or nursing school. So she started to look at her symptoms and realised it was menopause, and very much was aware of the lack of support out there in the healthcare field for menopause. So she set about on a journey of creating or developing her own private clinic. We now have about 70 clinicians that work at the clinic, and we see women going through lots of different menopause journeys from being teenagers right through to their 80s. Some women with histories of breast cancer. And lots of different stories, and we help manage their menopause. And then, in most cases, then they go back and have continued management through their GP practice.
Fantastic. Thank you so much, Sarah, for that excellent introduction, because I'm mindful not everybody might know that. Jules, do you want to introduce yourself? Thank
Yes,
you.
I'm so sorry that I'm slightly late. Maeve and I have just been trying to get on. So I'm Jules Knight. I'm a consultant Admiral nurse for young onset dementia, and I have an interest in menopause from a personal experience, and also to support women living with young onset dementia. So hello everybody, and hopefully we have Maeve with us as well. I've just seen her actually log on to Twitter. So I don't know if we're able to make Maeve or support Maeve in speaking, Vic.
I can't actually see Maeve yet, so I'm just looking to see why is that. Where?
Maeve has now got a picture, so you
Oh.
might be looking previously when we were doing the run through. She didn't have a picture on, but she's got a
Ah,
picture now.
I
Dark
see
hair and
her.
glasses.
I see her. Maeve, I apologise. It's because you've got your face is there, so I do apologise for that. You should have received a request now, so we'll get you up as soon as we can, Maeve, to actually introduce yourself. The request might take a little while to come through, so I've sent it my end, but it might take a little while to arrive on the live space. But hopefully you will get that very soon and be able to come up and join us as a speaker this evening. So I'm going to start the topic, and whilst we just get ready to start it, I'm going to ask Sarah if you can kick us off a little bit. We've heard, because I know George, you're going to be helping Maeve as well get sorted out to be speaking.
Yeah.
If Sarah, could you tell us a little bit about what is menopause? We've heard some obviously you talked about your own experience and how everybody's journey is different, and obviously I know something about menopause and what it is, but what are we talking about? What's normal? What do we mean by menopause?
Okay, so menopause affects every woman. So we all will go through menopause. And the word menopause can be broken down into menstruation, pause, stop. So we officially define menopause when your menstruation, your periods have stopped for 12 months or more. So that's when you're officially in menopause. And the average age for that is 51. Although we do come across women who go into menopause from 45 and some are as old as 55. There is often a family history as well, so we often find women that go into early menopause. Their mum has also often gone into early menopause herself. Early menopause we define as from 40 to 45. And under the age of 40, we call it premature ovarian insufficiency. So that's where women can go into menopause, which means their ovaries are no longer working, from as young as a teenager. And those women do really struggle because there are lots of complications in terms of health and also fertility issues. So menopause is when, as I say, your periods have stopped, but it also means that your ovaries are no longer working. So your ovaries work for all your younger reproductive years to help release eggs, for ultimately for pregnancy. But then the ovaries do gradually decline. And when the ovaries have stopped working altogether, so they shrivel up and stop working, that's when you go into menopause. Um, Perimenopause is the stage of time that leads into menopause, and that can typically occur anything up to 10 years before menopause. So, if, as I said earlier, the average age for menopause is 51, you can go into perimenopause from 10 years prior to that, so from your early 40s. And a lot of women can get many symptoms of menopause in those early 40s and mid 40s, which often aren't recognised as menopause. Sorry, Vic, I don't know how much you want me to cover,
No,
because I
that was
don't want to hog
no,
and
sorry.
talk, because I could talk endlessly about menopause, but
No,
I want to sort of keep it brief and just answer the relevant questions, really.
that was honestly that was really, really perfect. So, obviously we know that it's around the period stopping is something you would notice. But what other symptoms or what other things might you notice? I'd be really interested if you could provide some more information about that.
Okay, so the typical symptoms that people tend to know about are hot flushes and night sweats, and that's what women associate with menopause. But interestingly, quite a large percentage of women don't get these symptoms. So it doesn't mean to say if you're not getting hot flushes and night sweats that you're not going into menopause. There's a whole range of symptoms, and if anybody would like to have a look, you can just Google menopause symptom questionnaire and it will come up. We have produced one on the Newson Health website, and also on the balance-menopause.com website or the Balance app, you'll find this menopause symptom questionnaire. And it's quite a useful questionnaire to look at because there are lots of symptoms like muscle and joint pains, dry, itchy skin, bladder irritation, so that sort of frequency of needing to go to the toilet, vaginal dryness and soreness down below that can make you feel quite itchy down below, but also can cause sexual intercourse to be quite uncomfortable and sometimes painful. You can get problems with hair, feeling limp and losing its luster, and hair can fall out. People with the dryness also can get dry eyes. And tiredness, lots of what we call psychological and cognitive symptoms. So, feeling tired, having no energy, irritability, tearfulness, low mood, anxiety. Some women describe palpitations, loss of confidence. So, not feeling that you can do things that you used to enjoy doing. I had one lady that lives in London and frequently uses the tube. And then she suddenly, sort of almost, she felt overnight she was fearful of the tube and was spending a lot of money on taxis. And she was so frustrated. She said, "It's irrational, Sarah. I've used the tube for years. I know the tube system like the back of my hand. Why can't I go down and use the tube?" Also, loss of interest. So, where you would normally be very excited about going to your friend's 40th birthday party, now you're thinking of every excuse not to go, because you really can't be bothered. And that's not like you, because normally you would be so excited about going to your friend's birthday. And the brain fog. So, very typically, that sort of cognitive decline where you forget people's names, you forget. Even mid sentence, you forget what you're talking about. You lose confidence in important settings. So some people are working and have to present, do a sort of webinar at work, and they just feel as though they haven't got the confidence to do that anymore. And forgetting dates. And that's really quite a concerning symptom that people often will come to us about. But please do look at the symptom questionnaire, because I think it's often quite an eye-opener.
It would be good if we could try and share it into the space at some point during the hour, because I think it is useful for people to have access to that and to see it. If we can manage to do that, that would be really good.
Okay.
That would be really good. And I can see through the list that you've talked through, and I'm sure everybody else can, how if you're a lady who is experiencing some of these symptoms, that's potentially going to be really frightening and scary, and and actually I can see already some of the kind of link over into some of the presentation that somebody might be having when they're starting to develop a dementia. I just want to come to, I don't know if Maeve has managed to get herself up as a speaker. I don't think she has. I'm just going to ask Jules, I know you've been working behind the scenes to try and sort that. Do we know?
Yeah, I think Maeve received the invite through and then lost it while I was calling her just to talk her through it. So I
Right.
don't know if you can send the invite out
I can
to.
send it again. The other thing that you can do, Maeve, if you see on the bottom left-hand corner, there's a little mic button. If you press that, it would and it would say request the mic. You should be able to request to join us as a speaker that way as well. But I can send you the invite absolutely again and try and get you up, because I really want to hear from you this evening. It's really important that we do, because you've gone through some of this yourself.
She has. Vic, what I'll do is I'll spend a couple of minutes talking May through it again, and then I'll come back on. Is that
Perfect.
okay?
Yep,
Would that work?
that's absolutely fine. Thank you.
Brilliant.
And
I won't be a second.
that's great. So I think that's the thing, isn't it? That we know that the symptoms you've talked about there, Sarah, that you can see some of that is certainly brain fog. Potentially that might feel like the start of dementia for somebody, and something that people might be concerned about.
Yeah, absolutely. Quite a few of the symptoms overlap with early dementia. So, just generally sort of feeling low in mood, feeling tearful, dizzy, faint, headaches. But yes, absolutely, particularly the brain fog. And I know some patients do think that they are starting with dementia when indeed it is menopause and will be quite quickly managed with some HRT. I think it's a particular concern if you've got a family history of dementia. And so therefore it often is the first thing that we think about, but it's absolutely worth looking at the other symptoms as well, and talking to a specialist to see if HRT is something that you would benefit from.
I think that's a really good point, isn't it? Because actually, would HRT benefit people after, if you've gone through the menopause, yet you're having dementia? Is there any evidence to say that the HRT would help in that situation?
Absolutely. I mean, we are making lots of links, and there's lots of research out there already, and we're still doing lots of research on links with lack of estrogen and the impact that has on the brain. We know that the body is full of estrogen receptors, and the brain has got lots of estrogen receptors, which they need estrogen to function. And lack of estrogen, so therefore, when you go into menopause and your ovaries are no longer producing estrogen, your body is deprived of estrogen. And that lack of estrogen, we are seeing links with certain health problems, one of them being dementia. There's also osteoporosis, which is thinning of the bones, and cardiovascular disease and type 2 diabetes. But as we're talking dementia today, we definitely know there's a link with lack of estrogen and dementia. And we also know from research that, interestingly, women who have undergone surgical removal of their ovaries at a young age, so if they've had their ovaries removed, I don't know, for multiple cysts or ectopic pregnancies or other reasons, there is definitely an increased risk of dementia in these women. And therefore, we know it's important that we replace that estrogen. And so going on to HRT not only will help with that cognitive function, but it will also help protect you against the other health-related issues that I mentioned, so the osteoporosis and the cardiovascular disease. Osteoporosis is another significant condition that we need to consider, which is basically thinning of the bones. So we all probably know of some aunt that's fallen and broken her hip, and that's usually because of osteoporosis. So again, even with somebody with dementia, to actually give a HRT will help in terms of symptoms like hot flushes, headaches, muscle and joint pains that I mentioned earlier, but also will protect her bones. So there's far less likelihood of her sustaining a fracture if she did fall.
That's really interesting. Thank you so much. Beverly, I know that you put your hand up to ask a question. Is this a good time to come to you for your question? I'm wondering. Do you want to ask a question? You requested the mic to do so. Oh, I'm not sure if that's because you had a question you wanted to ask.
Hello, can you hear me?
We can hear you. Thank you
Oh,
for
sorry, I didn't know I had asked questions.
Ah.
Sorry, I'm new to Twitter and I was trying to turn the volume on and I couldn't find it. But then, silly me, I'd forgotten to turn the volume up. So,
well, and now here you are. You've joined us on stage. Well,
this is really interesting. This is really interesting. I'm intrigued by what's been talked about. So I didn't have a question, but thank you.
No, thank you very much, and well done for joining in. If you weren't sure that's what you were agreeing to do, so well done.
It was what I wanted to do. I'm a bit of a Twitter nerd. I'm not very familiar with Twitter, so I'm sort of stumbling around.
It's a new platform. Well, newish. It's been around for about a year. I think Twitter Spaces and doing this, so we're all kind of new and learning together. But no worries at all. And thank you for joining us anyway. What I will do in a bit is I'll remove you from a speaker so you don't feel the need. But if you do want to come up because you've got a question or anything you want to ask, just feel free to do that.
Will do. Thank you.
So, Jules, are you able to?
I think, Vic, I think that Maeve is back on, and I think her microphone is she's now got that working.
Let me I will send you the invite. Whilst I'm doing that again, Jules, do you want to tell us a little bit about some of the kind of symptoms and the links to dementia from your point of view that you're aware of whilst we're doing that?
Yeah, sure. Sorry, I'm going to have to just turn Maeve off because I've got Maeve on my mobile phone. Just 1 second.
In that case, forget that question.
Oh.
don't worry, because we really want to get Maeve up. So don't worry at all. I'm going to hold that because we'll come back to that question. So I'm going to go to ask you a question, Sarah. So do you think that ladies are getting the support and the help that they need at the moment around menopause? And also, if we think about that question on its own, but then with the added link to ladies who might be living with dementia.
Yeah, that's a really interesting question, Vic, and we are now beginning to recognise that there is a real lack of support generally across the board for menopause. We're doing lots of work and education with GPs and senior nurses and all nurses, to be honest, across the board, because even if a nurse doesn't prescribe, she's still seeing women for cervical smears and lots of other healthcare related issues where symptoms of menopause might crop up in the conversation. And it's really important that all healthcare professionals are informed and educated and up to date so that they recognise the symptoms as being menopause related, because so often they get issued antidepressant medication or they're given strong painkillers for muscle and joint pains and referred to physio, and lots of other referrals can occur before menopause is even considered, and a lot of these women will quickly recover on HRT. So I think there's a lot of work to be done, but with dementia particularly, I think especially when dementia has been diagnosed, then a lot of the menopause symptoms get put down to the dementia. And also, the patient doesn't really understand their symptoms sometimes and isn't able to verbalise what they're struggling with. And, sometimes it's very much the role of the carer to say, look, mum isn't sleeping very well, or mum feels very hot and sweaty, and particularly at night time. And it's really important as carers that you sort of bring that and raise that with the healthcare professional, so that treatment can be initiated. And also vaginal dryness and urinary symptoms, it's very much an area that we don't like to talk about. It seems a bit sensitive and it's a bit personal, but actually they are significant symptoms in over 50s, where the urinary irritation can cause urgency, the need to sort of rush to the toilet frequently and then only pass a small amount of urine, dryness and soreness and itching down below. And it's quite easily managed, even if we don't give transdermal HRT, so that's your patches or your gels that you hear people talking about. We can give local estrogen to the vaginal area in the form of a cream. So even if a pessary is not possible, so a pessary is a little tablet that you pop up into the vagina, and they're very useful. But even if they're not possible with a relative with dementia, a cream can be used in that area, and it would be amazing. It is amazing how much relief it brings to those symptoms. So it goes back to awareness first on behalf of the patient or the carer, and then going to the GP and just really sort of pushing that and asking the GP to consider HRT or local estrogen.
I think, when you were talking there, one of the things that I was thinking about is in lots of older ladies, I'm sure anybody who's worked in as a nurse will know that we see people having repeat urine infections, lots of pain and discomfort, being prescribed sometimes rolling antibiotics to try and
Yeah.
manage these infections. But so from what you've said there, is there a link then between the kind of repeat UTIs and vaginal dryness because of the menopause and the estrogen? Is there something that we're perhaps missing there?
Absolutely. I mean, the vaginal area and the bladder, so the sphincter at the base of the bladder, again, is full of these estrogen receptors. And we so often misdiagnose and do give repeated antibiotics, often without even an MSU being sent. And sometimes often those MSUs come back clear. And so, patients might get put on other tablets to try and help with the irritation. And we're not thinking dementia and lack of estrogen to those vaginal membranes. And again, it's remarkable how quickly those symptoms do resolve with something simple like some vaginal estrogen. And, I'm ashamed to say that my mother-in-law, she died with dementia about 3 years ago, and she lived with us about 6 years ago, and had terrible urinary urgency, and ended up quite incontinent and was often scratching down below. And this was before I trained as a menopause specialist, and I had no idea, and I sort of, kick myself now because it could have been quite easily managed. And it's just back to the awareness, really.
And I think that's literally what I was thinking when you were talking about the many people I've worked with over my career, who I'm thinking actually potentially this could have offered them great relief and been hugely beneficial and better for them, because then when they need the antibiotics, they're able to receive them, and they work better for them. So I can see there's a bit, perhaps a little bit of an awareness there. I'm also really excited to say that it looks like, Neve, we've got you up finally. Here you're here as a speaker, which is very exciting. Are you able to unmute now and say who you are and join us? Are you there, Maeve? You
Yes,
are.
yes.
Fantastic. I'm so pleased that you persevered with that. Well done. We've got
Um,
you here.
it was a helper, a great helper.
Yeah, you're here. Can I ask you to just say a little bit about who you are and tell us a little bit about your story, if you don't mind, because I think it's
Yeah.
a really good point now to bring you in.
Okay.
Thank
So
you.
my name is Maeve, and I was born and grew up in Dublin in Ireland, and moved over to England well, I moved anyway, and I've been a teacher all my working life, and my journey really to where I am. Well, it began in 20, 2014. Is that the right number? Yeah. Anyway, about 7 months. No, about 9 months ago. And the reason first time that I went to go to the doctor, because I was worried about my memory. was because it wasn't for anything silly. I knew I was forgetful anyway, which I just thought that was normal, And then what happened was that I was joking with because there was pigeons in our garden, and I joked about, and I said moonpig.com, and it was supposed to be funky fit, and I was like, how did that happen? How did that happen that I could completely change the name of it was just it frightened me, because I knew I had a bit of memory problem. So I went to the doctor and talked to him. So at that point, he said, you know what, Meave just got a little bit of a memory problem. It's nothing big. He said, I could send you to the memory clinic, but they'll only say it's just a bit of a, thing, so don't worry about it, sort of thing. And I'm not a pushy kind of person, unfortunately, for me, because I should have stood up and said, well, let me take it to, because actually I found out that actually you can't take, at that point I was still in my 40s, and you can't get to the memory clinic until you're 65. So that doctor didn't know that the age for people to be able to get to the memory clinic. So I left it 4 years because I kind of felt a bit of a fool, really. Yeah, I didn't, and that I was being silly, but obviously it got worse. So I went to the doctor again, and then she said, look, what we'll do, she said, I was crying because I know there's something wrong. And she said, look, we'll go, and because I was in my 40s, we did that test that got blood tests, and it turned out that I had my thyroid was overactive. And obviously, a lot of the symptoms of that is very similar to the menopause as it is to dementia. And so I was treated for that, and that was all but the reason that I went there was for something to help my memory. And when I came off it and everything was all fine, I was like, well, but that hasn't changed anything with my memory. Why has that happened? And so then it was in lockdown and that, and but I was still worried. And so I went to a doctor again, and I said, I was determined to get somewhere with it. And I rang the doctor and said, I need to get help, because I really couldn't do my job properly. I knew I couldn't do it, and I didn't know what it was. And so I told the doctor, look, I'm a teacher in a special needs school, and the children are finishing my sentences. That's how I knew it was really, things were getting bad. And so it took me, from the first time going to the first doctor, it took 6.5 years for me to get diagnosed. And since then, again, my mum, her menopause was awful because in her years, but she stopped at 57. So I'm a bit less than her, but so I really, I've just on my second month of using this patch. Yeah. And so that's sort of where I came through from the memory stuff and to moving into the menopause.
So you've had, I think you said, if I'm right, correct me if I'm wrong, 6.5 years is how long it took to actually get some kind of resolve and some diagnosis. Is that right, Maeve? Is that what I'm hearing?
Yes, and in terms of dementia, obviously that wasn't the first. There's been I don't know when it started, but that wasn't, like I said, I wouldn't go if I didn't really think I was worried about it. But yeah, so 6.5 years.
And that, I mean, that's, I know some of that you've had COVID to contend with, but nevertheless, that's an incredibly long period of time to be waiting for some kind of support and some kind of answers to the things you're living with and you've been living with. So,
Yeah.
how, and I guess the interesting point is do we think that that's common for ladies? Do we think, I know there's rarity, it's rare, we could use that as an excuse, couldn't we? We could say there's not many people who are going to be experiencing what you're experiencing, but there's probably quite a lot of people who are, maybe more than we think. What do you think, Sarah? I guess, can I just bring you in on this, and then Jules as well? Do you think that 6.5 years wait, do you think that's rare, or?
I don't think it's rare. I think it's quite common that there is such a long wait, and it's sad. I don't like to say that. I asked one of the lead clinicians at the clinic, just out of interest, how many patients are we managing with menopause? Now, she personally is managing one lady who's young onset, but certainly we don't have any others that we're aware of. So there's probably a few. We don't exactly know because she wasn't able to do a search, but it's certainly there'll be lots of women out there that are not being managed. And certainly older ladies, we did an audit actually in our practice, and we asked quite a lot of the other clinicians to do an audit in their practices of how many of their patients that were currently in residential care or nursing homes. Now, I know they're not the young onset, they're probably more older ladies with dementia, but how many of them were on any form of HRT, whether it be transdermal or the vaginal? And the answer was 0. And that's a really sad fact, and we need to change that.
Yeah. It's really is sad, isn't it? And I think I've said this many times to many people, but if menopause was something that happened to men, and sorry to say this, I think we'd be in a different scenario. People wouldn't be waiting for 6.5 years for a diagnosis and fighting for treatment, would they? It's just it's shocking.
Absolutely. And like I was saying earlier, we do know there's a link with lack of estrogen and Alzheimer's dementia. Now, we all know there are lots of different types of dementia, and I think what will be exciting for the future, and sadly it's going to take time, is to start doing some research on ladies like yourself, Maeve, with dementia who are now starting on HRT, and what longer term impact that has, and whether it will slow down the progression. We don't know that at this stage. We just know there are links with lack of estrogen and Alzheimer's. So there's lots of research to be done as well, but certainly, the sooner we can get you ladies on HRT, the better for your long-term health. We can't reverse, I don't think we can reverse what's already established. There's too much research needs to be done in that area, but I do wonder whether we can slow down the progression with it, certainly.
It's definitely something that we need to be exploring, because even if you consider that more ladies than men will develop dementia, will have dementia, because ladies live longer and live, but then more in the menopause, there's definitely, there's got to be research done into that. Jules, I can see that you've patiently tried to jump in on a few occasions.
No, I'm allowing you to talk. It's really interesting, but I completely agree with you, Sarah. I think it's an area that's completely lacking research, and there certainly needs to be some investment in how the hormones affect women, and how I think going forward, how the use of HRT can potentially slow down the progression of the dementia. That's certainly something we need to look at. I know Maeve was mentioning how long it took her to get her diagnosis, and just to give you some of the kind of research around that, it usually takes younger people twice as long to get a diagnosis of dementia as older people.
Mhm.
And some of the common things I think that women hear when they visit their GP is that they will hear things like, midlife crisis,
Mhm.
it's menopause.
Mhm.
Hopefully, the GP would look to do some blood tests to screen for kind of any reversible causes of cognitive problems. So things like vitamin deficiencies,
Mhm.
thyroid problems, those kind of things. When it comes, and Sarah may have already covered this, but when it comes to looking at our hormones as women, there's no definitive blood test that can be done, and really you're looking to symptoms of the menopause. I'm not sure if you mentioned the menopause app, Sarah, the balance app.
Yeah, I did briefly mention it earlier, and also the balancemenopause.com website. Yeah.
Yeah, I mean, that's certainly something I've used personally, and it's been particularly helpful. It helps you identify some of the symptoms of menopause and helps you pull those out so that you can discuss them with your GP, so that if menopause is an issue, then you should be able to get the support and HRT to sort of manage those symptoms. And I think also what Maeve was saying earlier, it's really important to go back to the GP again and again. If you're not happy with how things are progressing, if you're struggling, then do go back, which I know can sometimes be really challenging if you're not in the right headspace to do that. And I think particularly at the moment we struggle to get appointments with GPs, don't we?
Yeah.
I know myself recently, to get my latest HRT prescription, I had to wait over 5 weeks to speak to my GP.
Wow.
And fortunately the GP was happy to prescribe, but you always have that anxiety there that you're not going to get the medications that you need as well.
I think that's the thing, isn't it? That it's actually, we know, GPs, the awareness is increasing and people are getting, perhaps better. I'm just going to use that word around prescribing and getting people the treatment they need, and and doing that. But there's still some way to go in that, because I think many ladies talk about having to keep going back and challenging and struggling. And I'd like to ask you, Maeve, because obviously with the dementia as well, does that make it harder to challenge and around getting the treatment that you need? Have you found that an extra struggle? Do you know, or I guess you can't compare because you've only got your own experience to go by, haven't you?
Yeah. Yeah. um, it just feels, for me, apart from that I have dementia, it just seems bizarre that that I've had that first before I got the menopause. It's just backwards. It feels like. But again, it wasn't terribly easy, but I just I knew that I needed to have something happen, because the hot flushes are terrible. Have been, and it's I'm supposed to, with Alzheimer's, I'm supposed to get good sleep, but then that makes me up in the night, and yeah. So I just knew that I needed to just get something, and yeah. And the first doctor gave me just the gel, but the second doctor knew better, really, and gave me the full patch, which I'm grateful for. Even just today, it has been better than yesterday.
I think that's it, because we know some of the things that you've talked about there are things that we can provide treatment for. You can provide treatment to help you with various symptoms of the menopause. That you should have those options available to explore, shouldn't you? And
Mm-hmm.
they will make your quality of life better. Now, whilst you obviously, the Alzheimer's, the dementia, we haven't got treatments to stop those symptoms. We have got things that you can do to help, with the menopause, and those treatment options should
That's
be.
fantastic. Yeah, I'd love to hear more about that.
Yeah, they should be. Sarah, did you want to jump in
Yeah,
there?
I was just thinking, like Jules said earlier, what's really helpful is if you go armed with some information to the GP, because often by the time you get into the room, you've got 10 minutes, you feel under pressure, you're nervous, and your mind goes blank, and if you've got dementia, you forget why you've gone in there. And so to actually go in, the Balance app is really helpful, but also just to print off, if you can do that yourself or get somebody to help you print off the menopause symptom questionnaire that I mentioned earlier. And yes, we'll definitely try and, I'm not sure I'm very IT literate to try and put it on here, but we'll work something out. But it's quite easy. If you just literally, I've just done it myself actually to make sure it pops up. Just Google menopause symptom questionnaire and it will be the first thing to come up. And if you can print that out and then sort of tick the boxes and take that paper copy in with you, and you can say, look, this is a menopause symptom questionnaire, these are all of my symptoms, and you can actually score them. I think it's a little bit, a lot, or very much.
Okay.
You can actually tick, accurately, it's a little bit, quite a bit, or extremely. So it's 1, 2, or 3. You tick the boxes and just hand it to them and say, look, these are all of my symptoms, and that really helps you trigger a discussion, and stops your mind going blank, because in that short space of time, that 10 minutes that you've got, you do feel very pressurized.
So it's actually about making sure that when you're going to have that conversation, you've got all of this ready and you're well prepared, so that you can go in. I know, Jules, you have managed to share. So for anybody who's in the space, there's a thing called the Nest, which is a feature that's available. Essentially, what that means is at the top of this space on your phone, you should be able to see some tweets that Jules shared, and one of the ones that she's just put up there. So thanks for doing that, Jules. Is actually a link to the Balance app, so you can either click on that and save it now, or at least you know what it looks like and how to find it for later on. We've got about 15 minutes left, so I just want to, they always go so fast, these spaces, and they whiz by. I wanted to ask, just a quick refresh, if there's anybody in the room who wants to jump up and ask us a question, if there's anything that we've said that you think, actually, I'd really like to get some more information about that, or I'd like to make a point about X, Y, or Z, please do feel free to request the mic and come up and do that, obviously, providing it's to do with the topic that we're talking about this evening. That's the only thing to mention there. Jules, can I ask you just a quick question? So we talked a little bit earlier on about the link between menopause and dementia, and this is a question that I've been asked. Someone's sent me a message and asked me to ask this question. So what do we know about the link? What research is there out there? What's the current thinking around that?
I think, as Sarah was saying earlier, the research is not great. It's pretty poor, and we certainly need to invest in more research around the menopause and dementia. I think, as Sarah was also mentioning, we do see more women with dementia than men. I think it's about 65% of people with dementia are women. We do think that there is a link between Alzheimer's disease and the drop in estrogen. Again, this is kind of hypothetical, really. There's the research around it. It needs to develop, needs to grow. But what is there? It suggests that as women, because our estrogen levels naturally drop off as we come towards menopause, it's believed that estrogen does have a role to play in supporting and protecting the brain. Men, throughout their lives, continue to produce testosterone. And from what I understand, testosterone is changed in the brain to estrogen. And that estrogen, again, will help protect the male brain. And for us women, if we're going through menopause and we're losing that estrogen, then it puts our brains more at risk. Again, the kind of theories around that, it's not what's the word I'm looking for? The theories around what's being suggested need a lot more work and a lot more finances in terms of research. But it's really thought that the estrogen protects the brain because it stops the brain. Well, it prevents the brain from being essentially attacked by the free radicals. So it helps the brain maintain the antioxidants. And that's where the link is. But at the moment, the link is not entirely clear. I think it's clear from our perspective in that we see it happening, but actually we need the research, much clearer research to back that up.
Can I say something?
Yes.
Please do, Maeve.
No, it was just something that so I'm in a group of young people with dementia, and I tried to get to find out the difference between. I know that mine was 6.5 years to get my diagnosis, but the man who came into the group after me, which was about 6 months after me, it took him 5 months to get his diagnosis. And it's only one person, and I know there's other people, but I would really love to see how much time males have to wait to get to be tested compared to women.
Yeah, do you know what, Maeve? I completely agree with you on this, and obviously we've got skin in the game as ladies, but I think there is something around. We know about health inequalities. We know about science research where things happen. There's something I think as a group of women we need to to really kind of talk about this and raise this awareness and raise this issue, because it's you just can't imagine somebody having to wait 6.5 years in the United Kingdom to get a diagnosis. That's just it seems staggering.
But for me, it feels I blame myself for it, that I just didn't keep knocking on the door. But I don't think that I should have to be knocking on
I
the
was
door.
just about to say that to people. I think we shouldn't have to, and
Mhm.
even the fact that we've said and it's good advice. You go to your GP with the information at hand, and you're able to present the GP with, this is the information, this is the facts, and of course that all of that helps in getting that diagnosis. But actually, shouldn't it be that they need to be more aware of the symptoms and the presentation and the features, and to know the treatment options available, rather than us going and demanding service? It should be there. So I guess we've got some way to go on that. Sarah, any thoughts from you on that? Anything we can do? Any ideas?
I think it's such a challenging one. Like I said earlier, it's just really raising awareness. The fact that we're all talking about it is fabulous. The fact that there's so much social media coverage. I think Davina McCall's got another documentary on Bank Holiday Monday. I think it's at 9 o'clock. I think it's Channel 4, or it could be Channel 5. And it's just, watching those documentaries, talking about it. It's not a taboo subject anymore, and it shouldn't be. It used to be. I don't think our mums and our grandmothers really talked about menopause, did they? But we now talk about it, and I think that's important. And we are actually putting pressure on healthcare professionals, because we're saying, look, guys, you don't know enough, guys and girls, you don't know enough about this. You need to go away and learn. And I think it's great, because we're almost shaming healthcare professionals to learn, because I've got patients that have done more research than I have, and they come on and they say, I've read this article and I've read this research and I've read this study, and I think it's amazing, because they're telling me about things that they understand. And that's, it shouldn't be like that. Patients shouldn't have to be telling healthcare professionals how to do their job. But it is shaming healthcare professionals into learning more.
And actually talking about these things, isn't it? Because I
It
think
is.
probably women, we've probably been our own worst enemies in some way at not wanting to talk about periods and menstruation and vaginal dryness and all of these topics that we just, that people perhaps not that long ago you wouldn't have dared talk about even amongst your own family, let alone in Twitter Spaces. So actually we are coming. I know when I spoke to my mum about menopause, she kind of looked at me a bit surprised and said, "Oh, well, we've never even had that conversation." Then she kind of went, "Oh, I guess you are approaching the age where we should." And it's like, "Oh, I've thought about that." And so things are changing, and I guess in the future maybe that topic will be even less taboo, and everybody will be.
And the NICE guidelines, which is the clinical guidelines that healthcare professionals follow, they've just revamped their menopause committee. So they've just re-elected the whole committee, and they are re-establishing all the guidelines, which is really good news.
Good.
Because and there's one of our Newson staff is actually on the committee. So we are looking at changing the guidance, but also the way in which medical professionals are educated and introducing it into med school. So changes are happening. It's just going to take time.
And I guess
it's hugely. Sorry, I was just going to say it's hugely important as well if we think about our employers and for them to have an understanding of menopause, making sure that policy recognises that women go through menopause and it can have a huge impact on their lives. So I think it's something that we should all be campaigning about, actually, on a personal level and also on a professional level.
Jules, I love it because it shows me how in sync we always are on these things. So I'm just thinking exactly what you've said. And I guess the other thing for me is that, we know that nursing is a very female-heavy organisation, profession. Lots of carers of people with dementia are going to be female. Lots of people with dementia are going to be female. So there is skin in the game in getting this right, isn't there? So that whether it's us as nurses looking after ourselves, looking after our patients, looking after our family members, we're as educated as possible around actually, menopause signs, symptoms, and importantly, treatment options available. So there's it's good to hear where things are going, and I think now, probably due to the amazing work from the Menopause Society Newson Clinic, I've had conversations with employers who are putting together menopause policies and really considering actually how do I look after people who work for me around menopause, as well as how do I ensure that people are getting the right treatment and diagnosis in a healthcare professional way. Amazingly, we are coming towards the end, and one of the things I always do at the end is want to go around and have a roundup from our speakers on the evening and get some kind of thoughts, some final thoughts from them. I'm just going to kick it off by saying I'm delighted that you managed to get on, Maeve, so thank you for persevering. Maeve, you get top bonus points because not only have you managed to do this, but I know that you're new to Twitter, so well done for jumping in both feet and doing this, and thank you for joining us on this really important conversation this evening. Jules, can I grab some final thoughts from you, and then I'll go to you, Maeve and Sarah?
Yeah, I mean, I think for me, looking back, I worked as a young onset dementia nurse within a memory service, and I at that time assessed many young women in their 40s and 50s and early 60s for dementia. And actually, a lot of the time I told them, it looks very much like it's menopause. It doesn't look like dementia, after them having obviously a very detailed assessment. And at that time, it was like, you've got the menopause. That was that, really. And I just think now that we know that we can help women and support them access HRT, we all need to be aware of that. We all need to support women in accessing that HRT. For me personally, it's been a game changer, and I could scream it from the rooftops, to be honest with you. So yeah, HRT is the way forward.
Thank you so much, Jules. Maeve, can I come to you for some final thoughts?
Yeah, just that I feel so lucky that I'd be able to come to be here tonight, and I want more people to know about early onset of that, as well as the menopause, because they can twist around each other, and it's hard. It's so hard, but it's just so important that people to know that it's not just dementia, or it's not just menopause. It can be, and it's just putting that out, so more people can understand.
And we've got to keep raising that awareness, haven't we? And
Mm.
you know, you've done it so beautifully and so eloquently this evening. So I'm really glad that you persevered and were able to join us to
Got
share
there
your
in the
story
end.
this evening.
Thank you.
I know it's been so helpful having you here. Sarah, any final thoughts?
Yeah, absolutely. Thank you, Maeve. It's been fabulous listening to your journey, and I've learned some things myself tonight. I think my final thoughts would be, maybe get involved in some support groups. There are some groups on Facebook, and there are other groups that you can join and chat with people in a similar situation to you. But also those of you who are on this Twitter space who are nurses or doctors or healthcare professionals, to also look at maybe setting up support groups locally in your areas. So I work in GP
Fantastic.
practice, so yeah,
Fantastic.
it's prompted me really to look at setting up a local support group, and even sort of looking for patients on our list who have young onset dementia, and possibly even just approaching them and talking to them about their current symptoms, just to raise awareness of HRT as a possibility.
Fantastic. Yeah. That sounds great.
That does sound amazing, doesn't it? And then all together we will lead this revolution, or we'll be part of the revolution
yes.
to get women talking about menopause.
Very good.
I'm going to say ladies. I think looking through the audience, it looks like it has been a lot of ladies this evening, and I can see a couple of men there. So thank you very much for joining us this evening. As always, these sessions go really fast, but that's the way they go. Thank you so much. Next month, we're talking about living with dementia, and the fact that if you love somebody living with dementia, you're living with dementia too. So I hope you're able to join us for that session. Thank you, everybody, for your time this evening. Have a good rest of your evening. Thank you. Goodbye.